Alzheimer's.
Alzheimer's disease.
Alzheimer's disease.
Alzheimer's. Alzheimer's disease.
Alzheimer's disease. Alzheimer's.
Alzheimer's disease is a race against time. Yet the current global diagnostic process is standing still. Over 75% of all Alzheimer patients are undetected before they die. That's around 41 million cases, which is around the population of Italy. Why, you may ask? Well, because the status quo relies on expensive MRI imaging, which costs thousands of dollars per scan and takes around 3 months to get results back. To further dive into this issue, we interviewed a leading specialist in the field of neurology, Dr. John, from King's College Hospital in Dubai.
Yeah, certainly. I think all of these I've mentioned are not cheap. Of course, it's affordable to see a doctor to take history, study examination. The neuropsych assessment is not cheap either.
And so we realized that to save the patient, we don't need to replace the hospital. We need to fix the entrance. We need to shorten the diagnostic timeline from months to minutes.
Yeah, certainly you can. Previously, maybe 10 years ago, there was no real treatment for Alzheimer's disease. But now, things have changed. There are medications now that can stop the disease in its tracks. Yeah, certainly if an AI algorithm can help to make the diagnosis, I think that would help. So if everybody starts getting screened, then maybe we'll get many, many more people coming through our doors and getting properly diagnosed, and then we're going to have that opportunity to make a change. Yeah. And that's how it can help us.
We are 4 innovators from the United States,
The United Kingdom,
Kazakhstan,
and Hong Kong, bringing together diverse technical and medical backgrounds.
during a 2-month shadowing program at Queen Mary Hospital and interviewing patients and physicians.
we realized the critical gap between initial symptoms and the clinical diagnosis for Alzheimer's.
Introducing the future of Alzheimer's detection and support, AlziDetect. We are using machine learning and facial landmark recognition to provide early risk flagging for Alzheimer's. We are cutting cost from thousands of dollars per scan down to nearly zero for the patient, and shortening the diagnostic timeline from months to minutes. We are not competing with clinics or traditional detection methods. We are empowering doctors and patients with data and risk flagging to prioritize care for those who need it the most.
Let us walk you through the platform. We have built AlziDetect from the ground up using Python to ensure stability, to address the accessibility problem that many patients face in rural areas with clinical visits. We have made the software entirely web-based, meaning it is accessible on any device nearly anywhere on the planet. The core of our technology is the gaze test. By analyzing horizontal eye movement patterns and facial muscle contraction based on responsive stimuli, our proprietary AI model detects subtle neurodegenerative markers that are indistinguishable through human observation alone.
Unlike basic pattern recognition apps, we utilize a convolutional neural network. Our machine learning model is trained on real patient data, obtained through our private clinical partnerships.
Existing clinical tools require proprietary hardware and a specialist clinical visit. AlziDetect runs entirely in a standard browser webcam. No hardware, no cost, and most importantly, no effort for the patients. That's a market that no one else has touched.
Furthermore, we allow our users to get instant feedback by asking anonymous questions for licensed practitioners to answer. This is 100% free and allows them to get a professional opinion.
Using the blue ocean strategy, we identified what to eliminate, reduce, raise, and create. We eliminated specialized hardware and clinical visits entirely. We reduced patient costs to zero and wait times from months to minutes. We raised geographical reach to anyone with a browser, and we created something that did not exist: home accessible preclinical screening for the 41 million people who will never walk into a hospital until it's too late.
By using a B2B go-to-market strategy, targeting hospitals and medical institutions, we can ensure that we maintain consistent annual recurring revenue, with an estimated ARR of over $70 million, targeting just 1% of our serviceable addressable market. For clinics, AlziDetect reduces administrative burden and increases their throughput of patients. We have the proprietary technology, the exclusive data partnerships, and the global team to execute this vision. With this, AlziDetect is ready to change the way the world treats Alzheimer's. Thank you.